Fetal monitoring may be used at different times during your pregnancy and during labor to assess your baby's well-being. The fetal monitor uses ultrasonic waves to pick up your baby's heartbeat. This is converted to a heart rate, which is displayed as a number on the left side of the monitor and recorded as a variable line on the graph paper. The fetal monitor can also be used to monitor the frequency and duration of your contractions, but not the strength of the contraction. The contraction will be displayed as a wave or hill pattern on the graph paper and on the large screen above the monitor. Your nurse will place 2 soft, stretchy Velcro straps around your abdomen to hold the 2 transducers in place. Ultrasound gel will be applied to the transducer, which is placed on your lower abdomen to pick up the baby's heartbeat. This works in a similar way to the Doppler used in your doctor's office. It's not uncommon for the nurse to have to adjust the placement of this transducer during monitoring as the baby moves around. The second transducer, which is called a TOCO transducer, is pressure sensitive and will be placed on your upper abdomen to record the contractions. If you are having twins, you will have 2 transducers to pick up the baby's heart rates and 1 to record your contractions. The second heart rate will appear in the center on the monitor. The non-stress test is used to assess your baby's well-being by monitoring your baby's heart rate while you are resting and the baby is not being stressed by contractions. Your nurse will connect you to the monitor and record the baby's heart rate for about 20 to 40 minutes. A reactive or normal test will show that the baby's heart rate has variability within a normal range. A non-reactive test may indicate that the baby has health issues which need to be further assessed. When you are admitted in labor, your nurse will use the external fetal monitor to check your baby's heart rate and your contractions. After an initial period of monitoring, you can be disconnected from the monitor to walk or use other comfort measures. Your nurse will periodically reconnect you to the monitor to check your baby's heart rate, but you do not need to remain in bed for these checks. The monitor cords are long enough for you to walk around the bed or sit in the chair. If you are induced, if you receive medication to augment your labor, or if you receive an epidural for pain management, your baby will need to be monitored continuously until delivery. Epidural patients will also need to remain in bed.